Welcome to this tutorial on how to select a patient-reported outcome, or PRO. Among the most common questions that people have when thinking about including patient-reported outcomes in their electronic health record include, how do I know when to assess? How do I incorporate PROs into my clinic workflow? And what do the scores mean? But by far the most common question is the most basic. What measures should I use? In this brief tutorial, I'll be covering some considerations that you'll want to think through as you try to answer this question. Perhaps the most important consideration in selecting a patient-reported outcome is to understand what the intended use of the measure will be. Some PROs are very helpful for screening multiple symptoms or conditions. These measures need to be brief to reduce respondent burden. But importantly, short measures are typically less precise than longer measures. Another common purpose for measuring patient-reported outcomes is to offer a diagnosis of a condition or risk for a condition, such as depression. Measures used for diagnosis should be longer to ensure that condition is measured reliably. In other applications, you'll want to monitor a person's health over time. Such applications require more precision than screening measures and will allow a clinician to evaluate how a patient's health is changing based on the nature of the disease or treatment. For still other purposes, a team may want to use a patient-reported outcome to measure quality. PROs can be used as an indicator of quality of healthcare. Measures of the performance of healthcare providers or healthcare delivery organizations can be developed and have special needs that need to be considered. While it's somewhat obvious that we need to keep in mind the intended use of a patient-reported outcome, this is an important factor that's sometimes overlooked. Why does it matter? It matters because the selection of a patient-reported outcome may help determine whether the data that you receive will be helpful. For example, if you're interested in measuring depressive symptoms over time, use of a very brief screening instrument may not capture or reliably assess depressive symptoms in the population that you care about. And so the data that you get from a screening instrument may not provide the level of precision necessary for either diagnosis or monitoring. Another factor to consider when selecting a PRO is whether one wants a global or specific measure. Global measures are good for assessing overall perceptions of health and health-related quality of life. These may be measures like the PROMIS 29 that are not intended for or designed for a specific patient population, but can be used to compare patients across different patient populations or to compare clinical and non-clinical populations. In other cases, individuals may want to use or think about specific measures. Specific measures are preferred when you are interested in very precise symptoms or concepts for a target population, for example, as defined by age, condition, or procedure. Selection of specific measures can be guided by either clinical wisdom, research, or ideally both. Another important consideration in selecting a PRO is a determination or assessment of whether the measurement properties or psychometrics of the measures are sound. These properties include, but are not limited to, the theoretical underpinning that help to design the patient-reported outcome, whether the measure is reliable or produces scores that are reproducible, whether the scores are valid or fit for purpose, measure what they are intended to measure, whether scores on the measure change with expected changes in patients over time, whether the scores are readily interpretable, the burden that the measure places on either the patient or respondent or the individual or system that's administering the measure, and whether there are any cultural or language considerations, for example, with language translation, in place for the application under consideration. When in doubt, our firm recommendation is to identify a patient-reported outcome measurement expert to help talk through some of these and other considerations when deciding on which measure or measures to include in your application. While there's usually never one single best answer, there are many considerations, as highlighted here, that may need to be taken into consideration in making a final selection on a measure that may be well designed for the purpose and will provide data that are useful and informative. Funding for this tutorial was provided by a grant from the National Center for Advancing Translational Sciences from the National Institutes of Health. Thank you.